Just gonna wash my hands when I come in the room. Hi Kendall, my name's Greg. I'm gonna be your nurse today. I'll be performing your head-to-toe assessment. It should only take 15 to 20 minutes, but let me know if you have any questions or anything while we're doing it, okay?
Okay.
Hey, did you have any questions or concerns before we get started? Awesome. Okay, I'm just gonna go ahead and have you change this down and use the bathroom before we start. Thank you. Okay, Kendall, I'm gonna assess your mental status first. Can you tell me your full name?
Kendall Marie Healy.
And your date of birth?
12/07/1999.
Okay, do you know the date?
Today is November 21st.
Awesome. And can you tell me where we are right now?
At the doctor's office.
Perfect. All right. Patient is alert and oriented ×4 and is aware of person, place, time, and situation. Or I'm sorry, why are we here today?
Oh, for my physical.
Awesome. So to situation as well. Okay, Kendall, I'm gonna just start by taking your vitals. So your temperature. Awesome. And then I'm going to take your blood pressure. Yes. Sorry, the cord's got all tangled. Okay. All right, 118/76. And then I'm going to take your pulse. I'm going to use the clock on my phone for this. Sorry about that. Come on, watch with me. It'll just be about a minute, okay?
Okay.
All right, Kendall, your pulse rate was 68 and regular and 2+, and then your respirations were 16. Okay, I'm going to assess your gait, so just stand up for me. And then I'm going to have you walk from here to the doorway. All right, and back. Good. Patient's gait is even, smooth, balanced. Weight is evenly distributed. Toes are pointing forward. All right, I'm going to have you put your feet together, arms out like this, and then close your eyes and put one finger to your nose, and then switch arms, and then do that faster. Awesome. You can go ahead and stop. Patient exhibits a negative Romberg test. I'm going to test your muscle strength. If I could just have you take a seat for a second and put your arms up like this. Push against my hands. Okay. Back, forward, out, in, forward, and back. Good job. Patient has 5 out of 5 muscle strength and all extremities bilaterally. And then there's no joint swelling or anything like that. All right, I'm gonna go ahead and take some pulses while I have you like this. So temporal pulse, 2 plus bilaterally, your brachial pulses, 2 plus bilaterally, radial, 2 plus bilaterally, popliteal is 1 plus bilaterally, posterior tibialis is 2 plus bilaterally, and your dorsalis pedis is 2 plus bilaterally. Okay, Kendall, I'm going to test your eyes. All right, let me just look at them real quick. Pupils are equal, and then I'm going to shine a light in them a couple of times, okay?
Okay.
Make sure you can see. Okay. That's okay, you can just look at my nose. All right. Awesome. Pupils constrict and pupils react to light both direct and indirectly. Okay, if you can look at that wall for me and then look at my pin light and follow it. Okay, pupils constrict and converge. Now I'm just going to look inside your mouth. Okay, just open up it for me. I'm gonna put this on your tongue and just say ah, okay? Awesome, just look at your cheeks. Great. All right, uvula rises midline on phonation. Oral mucosa is pink and moist, and patient appears to have all of her teeth. Excuse me. All right, I'm just gonna take a look at your back real quick. Move your hair. I'm gonna touch your neck real quick just to test, look at your trachea. Okay. Awesome. Trachea is midline. Go ahead and swallow. Okay, patient swallows without any deviation, no trachea deviation. Upon inspection, back is symmetrical, even. There's no lesions. I'm just gonna put it up real quick. No lesions, bumps, masses from inspection. Skin color is evenly pigmented and consistent with ethnicity, warm to the touch and dry. I'm just going to palpate, no masses or bumps felt. Spine is midline with no bulges or retractions. All right. AP to transverse diameter is 1 to 2, and then I'm going to place my hands on your back. Just take a deep breath for me. Good job. Okay. Chest expansion is symmetrical. All right. I'm going to put my hands on your back, and I want you to say 99 each time they're on there. Okay. Go ahead.
99, 99, 99.
Good job. Tactile chromitis is symmetrical and decreases as I move down her back. I'm going to have you do that again, but this time with my stethoscope. Okay.
99, 99, 99.
Awesome. Vocal transmission is soft and muffled. All right, I'm just going to percuss real quick. Good job. All right, resonance heard over lung fields. I'm going to listen to your breath sounds. When you feel my stethoscope, just take a deep breath in for me. Okay. Okay, vesicular breath sounds heard over all lung fields. No wheezes or crackles. I'm sorry. No accessory muscles being used when breathing. Yes. Okay, now I'm just gonna look one more time. Chest is cone-shaped and symmetrical as well. I'm gonna also test your kidneys while I'm back here. I'm gonna hit my hand on the back of my other hand. You shouldn't feel any pain, but just let me know if you do, okay?
Okay.
Any pain?
No.
No. Okay, great. All right, let me just move to the front here. We're going to do the same thing, but on the front. So upon inspection, chest is even and symmetrical, and so look. Thank you. Okay, no lesions. Skin is evenly pigmented and consistent with ethnicity. I'm going to just palpate any tenderness. Right. No masses or bone spells either. I'm going to percuss. All right, resonance heard over lung fields. Now I'm going to listen again. Just take those deep breaths for me while I do. Awesome. Vesicular breath sounds heard over lung fields. No wheezing or crackling from the front either. Okay, let's take a look at your arms real quick. Okay, skin is evenly pigmented, warm to the touch and dry. No edema present bilaterally. No lesions or anything like that. Capillary refill is less than 3 seconds, and skin trigger, skin recoils immediately. I'm going to look under your legs. No edema present on her legs bilaterally either. No lesions. Skin is evenly pigmented, consistent with ethnicity, dry and warm. Yes. Any pain while I was doing that? Okay, awesome. All right. I am going to have you lay down. Lay this way. Yes. You might put one more pillow under your head. That's okay.
Yeah.
All right. There you go. Whoops, sorry. Okay. I'm just going to look at your neck first. Look that way. All right. Okay. I can see the patient's external jugular, and then I'm just going to feel your carotid. Okay. Feel it over here as well. All right. Carotid is 2+, symmetrical and even. Internal jugular cannot be seen. All right. I'm just going to look at your precordium. Okay. No heaving noted. I'm going to go ahead and feel some of your pulses to do with your heart. So your aortic, 2+, and then your pulmonic, just a little too over. Then your herbs points, right in the middle. Right, tricuspid and mitral. Okay, all of those were 2+. I'm just gonna take a listen to those now. All right. Okay, so at the aortic point, S2 is greater than S1. At pulmonic, S2 is also greater than S1. At herbs, both points are equal, S1 and S2 are equal. Tricuspid, S1 is louder than S2. All right, and then at mitral, S1 is greater than S2 down there as well. I'm also going to take a listen with the bell of my stethoscope to hear for any murmurs. All right. No murmurs were heard in the aortic, pulmonic, herbs, tricuspid, or mitral points. While I have my stethoscope out, I'm going to listen to your carotid artery for any bruits. And then, oh wait, I'll do that first. Awesome, no bruits were heard. I'm also going to listen to her apical pulse for any bruits. Okay, no breeze heard. I'm also going to just take that impulse. I'm going to listen for a full, or going to take that for a full minute. Sorry, using my phone timer again. Actually, I'm going to listen to that, not just feel it. But I'm still going to time that. All right. So 1 full minute. All right. Impulse was also 68 beats per minute. Okay, one last thing about the stethoscope, or at least for now. I'm going to listen to a few arteries for any breeze. All right, so aortic, no breeze noted, renal. All right, on the other side, no breeze noted, and then iliac. All right, no breeze noted in the iliac or renal arteries bilaterally. Okay, if I could just have you lift up your shirt to right below your bra line. All right, thank you. So upon inspection, abdomen is even, skin tone is evenly pigmented, consistent with ethnicity. There's no lesion or bumps noted. Umbilicus is midline and inverted. Okay, going to auscultate. Just going to be listening for vowel sounds, starting in the right lower quadrant. Okay, vowel sounds are normal active and heard every 3 to 4 seconds. Now I'm just going to percuss. Okay, general tympany heard over the abdomen except for over the liver in the right upper quadrant, and over that I hear dullness. I'm going to palpate now. You shouldn't feel any tenderness at all. Just let me know if you do. I'm going to start with light palpation. All right, no bumps or masses noted. All right, I'm going to move on to deep palpation. This is more uncomfortable, but again, shouldn't be tender. All right, no bumps and masses noted there either. I'm going to move on and palpate for your liver. Take a deep breath in for me and out. Good job. I can feel the firmness of the liver. I'm just going to palpate for your kidneys now. Okay, on this side too. I know it's kind of ticklish. Kidneys cannot be found bilaterally. I'm going to just feel for your spleen real quick. All right, spleen cannot be felt either. Okay, you can go ahead and pull your shirt down and then just sit up for me. All right, did you have any questions or concerns, Kendall? All right, well, that concludes our head to toe assessment.
Thank you.
Yes, ma'am.